My name is Trevor Wright, and I'm a nurse practitioner. I work with Neura, and I've been in neurology or neurosurgery for the last 10 years or so. I started as a bedside nurse working on a neurology neurosurgery unit. And really, actually, what prompted that was that I had an uncle who was suffering from a brain tumor at the time. And so that first got me interested in neurology, ended up working on the floors that he was treated on. Then I went back to school for advanced practice nursing at the University of Pennsylvania and kind of carried that passion for neurology with me through my education. Then, as I was looking for my first roles, I've worked in essentially community neurology for the last 7 years. Within a specialty, oftentimes a lot of providers like to subspecialize into a very specific focus. I really like being more of a generalist, so I enjoy the whole spectrum of neurology. But my particular interest and a lot of my work with Neura revolves around treatment of dementia disorders, including things like mild cognitive impairment, different types and causes of dizziness, different types and causes of tremors, and then different nerve pains and altered sensations. My philosophy of care, my approach to treating patients is really twofold. The first is to practice evidence based medicine. I think that there's a wealth of knowledge, and it's important to draw on that knowledge to make the most informed decisions in partnership with patients. Now, with that being said, there's also a level of the art and the science of medicine. So there's that art as well, that intuition that comes from years of experience and time. And then the other component of my approach to care is just being patient first and patient centered. I do truly want to treat each patient like I would want my own family or friends to be treated. And that really motivates me in what I do. I think that unfortunately, in different aspects of healthcare, sometimes we lose touch or lose grip on that patient first approach. And I think that that's something that Neura does well. I think we at Neuro try and embody a patient first, patient centered approach to care. And I mean, if you ask most healthcare providers why they initially got into it in the first place, it's to help people, right? And somewhere along the way, because of the broken systems that we have and all of the challenges, we certainly can lose touch of that. And it's certainly something that I need to be satisfied in my career. But I also, when I interact with the healthcare system, that's exactly what I expect and what I want as well. So, really keeping first things first. And that is that we are in the practice of helping people to alleviate suffering, to improve their quality of life, to optimize their wellness. While I don't have any chronic conditions, I certainly have lots of friends and family that have been touched by chronic or even terminal illness. Those experiences and stories stay with me and are part of why I'm so empathetic towards patients. I have a really relevant one. I have worked with a colleague who was in the office setting, and she really suffered from debilitating migraines or things that I've treated for years. And I don't think that I fully understood how debilitating they could be until I saw how often it really interfered with her quality of life, having to leave work, miss work. From a, I guess, business standpoint, that's a lot of lost productivity. So it's really hard to manage that. But from a human standpoint, I saw that this person who was a colleague and a friend, right, like, had no vacations, had no ability to do anything other than work and then miss work because of her migraines. And despite so much that she had tried, she really struggled to make a lot of progress for long periods of time. And then had periods where she had a lot more migraine freedom. So that gave me like a whole new appreciation and perspective of what a patient goes through and how you can easily dismiss something like, oh, it's just a bad headache. Like, get on with it. But you realize how much it really is disabling. I think that advocacy is vital for a few reasons. One, we have a really complex health system that's hard to navigate. And myself, as a healthcare provider, I have a difficult time navigating it for myself, for my friends and family. And so, as a provider, partnering with patients and being their advocate, I think is vital. Another aspect is unique to neurology in that many of the conditions that we treat, whether someone has a cognitive impairment and cannot advocate for themselves, or has suffered a stroke and has lost the ability to communicate to to some degree, you really need to be their voice. You really need to engage with their caregivers and their friends and family so that this person that has, suffered this loss is able to get the best care possible. There's a few groups that I feel particularly passionate about. One is certainly stroke care. I've done some really high level stroke care in the past, and that is a patient population that I really feel passionate about. It's a condition that's going to affect and touch a lot of different people's lives. And most people's family knows someone who suffered a stroke and the sort of loss of function that can come along with that. So I've been involved in patient and family support groups for stroke. And then I also feel passionate about advocacy and support of dementias. Dementia is one area of neurology that has a lot of opportunity still for improved evaluation and treatment. And I think that we're on the cusp of a lot of important breakthroughs that will really revolutionize and change the treatment plans for patients. But those kinds of breakthroughs and progress require a lot of money and support and attention. And so I really am a proponent of keeping the attention there.